Hello friends, welcome to Residency with Dr. Purnima. So this one video is going to solve all the questions that you have in your mind if you want to pursue MD or DNB radiation oncology in India in especially 2025, because as you know that the counseling has begun and people are looking for options, and they're looking for colleges, and they're looking for what colleges to choose, how to choose them. So there is a lot of chaos, and it comes directly into my inbox and in my DMs, because I think radiation oncology is such a branch that you do not have much exposure. And so now this is a very comprehensive video. It might be a bit long, but please bear with me, and it is going to benefit you all. So first and foremost, most important point, madam, should I go for MD or DNB? So first question, very simple answer that I want to give you is focus on your learning and growth. It doesn't matter if it is MD or DNB. If you are getting MD in a good college with good machines and good exposure, then you can definitely go for it. But if you are getting MD in some peripheral college where there are not much patients or not good machines, like they do not have Linac, they do not have Brachy, they do not have good exposure, then it is better to do DNB in that case, because DNB hospitals are generally private hospitals and they have the latest techniques, they have a good patient flow, so you learn eventually better. Only advantage of doing MD is you can do a DNB or you can add on a DNB degree later on. So after DNB, you cannot do the MD and vice versa. So that is the whole point, that only if you are doing MD for the namesake, then it is not important. But there is a catch to it. Now, another question, we'll just sweep on to another question, that is, can I do DM med-onco or medical oncology after MD radiation oncology? Yes. Right now you are eligible, and I don't think that this is not going to be a feeder branch in the future, because their chances are very less that you won't be able to pursue DM med-onco. So yes, you can do that. Now, there is a catch. If you are very sure that you want to go for DM med-oncology, then you can choose an institute which has a higher chemotherapy exposure. Now, if you are really very clear, then the radiation machines or radiation exposure does not matter that much, because if you choose DNB, generally they are institutes where there is a separate medical oncology department, and the DNB residents do not get much exposure to chemotherapy per se, and they have more exposure to radiation therapy. But in MD colleges, in institutes where there is not a separate medical oncology department, you get a good exposure to chemotherapy. And in your NEET SS paper for DM med-onco, most of the questions are from oncology. So if you're looking for that, then doing MD medicine also, you can go into that. But the MD medicine course curriculum is very different from what we have in radiation oncology, and this course curriculum is going to help you more. So what did I say in conclusion? If you want to go for DM med-onc and you're very clear about it, then you can choose an institute which has a better chemotherapy exposure, which will get better in MD as compared to DNB. Okay, so these are the points which you can base your quest or your thinking upon. Secondly, I want to tell you that I have prepared a list for you. Yes, this list is authentically sourced from people who are working in those institutes. So this is a list, and this is currently updated. This is the latest 2025 information, and it is available freely for you to download down below. You can just go check it out. There are more than around 80 colleges that I have my acquaintances from, and this is very personal information that I've taken from these people and presented to you, so that it is very easy for you to choose from. So what I've included in that is the state. Okay, so which state the college is from, the name of the institute, whether it is an MD or DNB institute, how many students per year seats they take up. Then I have given whether they have cobalt, whether they have Linac, whether they have brachytherapy functioning ongoing right now, and do you have a chemotherapy exposure. In that I've mentioned if it is a good exposure, that is yes, you have a good exposure, or you have occasional or minimal exposure. And I've also added a very important part, that is academics. So in academics, you have to choose whether you want to go for the institute which has a good academics, regular academics, occasional academics. So you can base your choices upon that, right? So this is a gift from me, which I have curated it for you, and I'm very happy to present it, because there has been a lot of chaos and you have been asking me for this a lot. But if you still ask me, ma'am, rank 5 best institutes that you should do radiation oncology from. So I'm sorry, I cannot answer that question because it is variable. Right, I have told you, if you want to pursue medonc, there are different sets of institutes. If you want to go for hardcore radiation oncology, there are different sets of institute. If you are more focused upon research and academics, there are different sets of institute. So what your outcome is, or what state preference you have, or whatever, that is very very different, and it is very individualized. So I have tried to make a list. Now please don't make me tell you what are the 5 best institute, because that is very individualized, very personalized, and that cannot be actually conferred to. Secondly, I want to tell you, if you have any doubts, you can just contact us. You can write down the comments below, but if the comments are not answered, you can obviously go to our DMs in Instagram. We have a page by Radonk Residency by Dr. Purnima. The same name, you can just find out there, and I usually reply easily and more efficiently on Instagram than on YouTube. So you can just contact us there, and we'll solve if you have any more queries regarding this and your personalized questions. Okay, now just a final tip to add on to how to choose the colleges. So the first and foremost column I've mentioned is about the state, because it is very very important for me to spend my 3 to 4 years into learning, and I want the state and the place to be really really comfortable and something that I want to choose for myself. So the state is important, and after that I think you should definitely go for the machines, right? Because that is what you have to learn in this. So machines is important, and then you have the exposure of chemotherapy. I think the institute which has a cobalt, which has a linac, which has brachytherapy, has chemotherapy, and has exposure to academics is the best institute, because you get to learn everything from 2D planning to IMRT planning to SBRT planning, and so on and so forth. You have brachytherapies, then you have chemotherapy exposure. I think if you know everything, you will become a better radiation oncologist. You will have a better exposure to all the modalities that are available and that you can practice. So I think that I will rank at the topmost, and then you can just choose according to your wishes. Thirdly, the last thing I want to point out is academics is important, and you don't have to worry whether there is physics or there is maths or there is biology or there is radiation involved, because you are not exposed to it. We have come up with this very very interesting app, and it will solve all your academic doubt. It will solve, even if your institute does not offer you academics or does not train you to read and learn and understand the concepts, we are here to help you. So Radonk Residency app is always there for you, and you can just check it out. We have some free videos, so if you have any doubts, you can just go through it and get to learn. We are also coming up with newer modules for better contouring, for better 2D planning and everything. So that is in process, which we're going to add. But currently we have all of these things of your practicals and theory exams and whatever you need, we all have it. So I think this is a whole comprehensive information that you require for choosing this branch or choosing the colleges of your choice. I think go for informed decision making. So just don't go because I have told you or somebody else has told you to take this branch, because this is going to be your life. See, if you don't take this branch, somebody else is going to take it. This is a clinical branch. It is not going to go like the seats are not going to go vacant, right? So if you have the opportunity, if you have the choice, and if you want to go for it, then only go for it. Don't go because it looks attractive. Don't go for it because somebody else has told you that this is a good branch, or somebody from the same fraternity has told you that there is saturation, there is this, that. I think make an informed decision. I have put n number of videos on this channel for you to go through, make a wise decision. Visit a center near you, see how it look like, what the day in a radiation oncologist life looks like. If you like it, then you go for it. And just remember, if you don't take it, somebody else will, and he or she will experience the magic of this brand. So it all rests upon your interest and your knowledge and your informed decision making. So with this, I stop here. I put the list down below for you to check it out. This is sourced from the authentic sources. If you have any doubts, you can definitely get to us in the DMs or in the comments below, and we'll try to help you out as much as we can. So all the very best, and let me know when you get a branch, and I'll be very happy to connect with you once you enter this branch. All the very best.